Maintaining a proper pH balance helps our body self regulate its acid base levels. Important physiological functions keep us healthy to support critical biological reactions, metabolism, and hormone balance. Otherwise, our body will struggle to maintain homeostasis, and we may see signs and symptoms of metabolic and respiratory acidosis or alkalosis. Urine pH may provide the healthcare provider a clue to support an assessment of the acid base balance of a patient. We'll briefly go over development of pH measurement, UA collection standards, proper urine reagent strip technique, quality control, and interfering substances. Stay tuned afterwards because we'll go over several questions in our ACP study guide over pertinent urine pH topics. What does pH stand for? Potential hydrogen. It measures hydrogen ion concentration in a solution. More hydrogen ions is measured at a lower pH or more acidic, while fewer hydrogen ions mean a higher pH or more alkaline. For your information only, how is pH calculated? pH is the negative log of the hydrogen ion concentration in moles per liter, or molality. The negative log, or often known as the neg log, is the inverse of a number's logarithm. Okay, before I lose anybody, here's the equation. The low numbers are acidic, like gastric pH at 1.5 to 3.5, good for digesting food and killing foreign microorganisms. Blood pH is normally maintained between 7.35 to 7.45. Our ACP study guide lists urine pH ranging from 4.5 to 8.0. Seminal fluid usually has an alkaline pH at 8.0 to 8.5. FYI, litmus paper made from water soluble dyes extracted from lichens was used as an old form of pH testing for acidity and alkalinity. It is still in use today in the clinical lab for urine send out tests that need hydrochloric acid preservation. FYI, the first pH meter was invented in 1934 by Arnold Beckman, an American chemist working at Caltech Institute. He founded National Technical Laboratory, which became Beckman Instruments, which bought Coulter to form the Beckman Coulter Company, which makes many of our lab instrumentation today. Modern urine reagent strips are sold under trade names, including Multistix 10SG by Siemens Healthcare Diagnostics, Chemstrick by Roche Diagnostics, and Audion by Iris Diagnostics, owned by Beckman Coulter Incorporation. Multistix, Chemstrip, and other reagent strips employ methyl red and bromothymol blue methodology. Colors progress from orange at pH 5 through yellow and green to a final deep blue at pH 9. Storage and quality control concerns include storing at room temperature at room temp, especially below 30 degrees centigrade, and storing dry with a desiccant to avoid humidity interference. I noticed that moisture will turn the nitrite pads pink, a false positive, and we discard old strips according to manufacturer's recommendations. Quality control of urine reagent strips is performed according to specific laboratory protocol, usually on the day of use, and typically strips are checked for quality control with positive and negative controls like using biorad urinalysis levels 1 and 2. You can dip the urine reagent strips in the urine container or use a clean pipette to dispense horizontally. After blotting the strip with tissue to avoid interference from adjacent pads, we follow the manufacturer's recommendations for timing, in this case, 60 seconds. There are no known substances that directly interfere with urine pH measurements. However, we may see false positives with runoffs from the adjacent acidic protein area. This happens when you dispense urine at an angle or downward so that the runoff will run downward to the adjacent pad. To avoid runoff interference, practice proper UA reagent strip technique. delivering the urine horizontally, blotting with the pad and avoid excess runoff. Following the manufacturer's timing to read the reagent strip precisely is important because the color pads will change with overtiming, giving a false reading. No known substances directly interfere with pH readings. However, bacterial growth indirectly interferes with pH because if unchecked at room temperature, urease enzymes convert urea to ammonia, which is alkaline. A pH above 8.5 suggests that the urine sample is improperly preserved. This is a true statement because our renal physiology is not capable of producing urine with extreme alkaline pH levels in this range. In our alveoli, carbonic anhydrase catalyzes the reaction of bicarb to carbonic acid, which breaks off into CO2 and water. The CO2 is blown off in air. Here's a limited list of causes of acid and alkaline urine. We see that urine pH is just one sign to support a diagnosis or pathological condition. The following questions and answers are similar to the ones in our ACP Board of Certification Study Guide. Thank you for your time, attention, and support, and we hope to see you in the next video.